Well, good morning. Good morning. Thank you, Keisha. I am delighted, truly delighted to join you for your inaugural Bloomberg American Health Summit in your capacity. Wait, Keisha, you can't go. Just wait a sec. In your capacity as the 12th Dean of the Bloomberg School of Public Health. You know, people allude to this being a challenging time for public health. That is indeed true. It's a challenging time for universities and indeed for university presidents. And there's lots of decisions that you're forced to make that you never dreamed in this, that you would have a moment when you would have to make decisions of this character in response to the kinds of challenges we're facing. But for me, this past year, the easiest, most straightforward decision, the most obvious decision I had to make was to appoint Keisha as the next dean of the Bloomberg School. That was a delightfully easy decision. So Keisha, thank you for your leadership of the school at this critical moment and your steadfast commitment to public health through efforts like the Bloomberg American Health Initiative. You can go now. And to Josh and Michelle, the comedy stylings, I'm trying to get a sense year over year, whether it's getting better, staying the same, getting worse. Josh, Michelle's good. You stick to the podcast. As Keisha shared, it is the common aim of sustaining more than a century of public health impact that brings us together today from across the country. Indeed, we see that impact manifest through small-scale interventions, which when collaboratively designed and executed, can transform the health and well-being of individuals, their families, and their communities. We see it in the efforts to ease food insecurity for families in New York City with community summer meal programs, to save lives from suicide in Puerto Rico by changing how local news reports on these tragedies, and to integrate addiction treatment into primary care programs in Texas. And we see that same spirit evident right here in Baltimore in the work of the Innovation Fund for Community Safety, which is launching its second cohort of academic community partnerships this year to bring a grassroots informed approach to bear on safety and violence prevention efforts in our beloved city. No matter where you're joining us from today, each of you is here because you share the firm belief that the solutions to our greatest health challenges will only succeed if they have the support of the communities they are intended to serve. But as you well know, to succeed, this work requires extraordinary trust between our public health institutions and practitioners on the one hand, and our communities on the other. And yet, as we know, this trust has eroded over the course of the pandemic and continues to struggle today. As trust has waned, so too have the resources that long powered this work. Dramatic funding cuts to public health efforts nationwide will contribute to the rising cost of medical care, increased hospitalizations for once preventable diseases, and an ever-widening gap in life expectancy evident within our nation and among peer nations. As we seek to prevent these outcomes, the questions before us are, how do we revive trust in and restore public support for public health? How can we ensure the field's guiding promise to deliver results for our communities continues to be fulfilled? I believe that the work that you are doing here through the Bloomberg American Health Initiative, as well as the work that you're pursuing in your communities, is a crucial part of that answer. We see the partnerships you forge, the insights you glean from deep immersion in and dedicated collaboration with the communities you serve, and the capacity you have shown to bring rigorous analysis of evidence, including the evidence derived from those experiences and insights, to shaping effective public policy. So as we navigate this challenging moment together, I thank you for bringing your ideas and your perspectives here, and in turn taking the best ideas of these days together back to your own work in cities and towns across the nation. We're so very proud of the work that you're doing and the impact that you're having. So, thank you for being here. And now it is my great pleasure to introduce Michelle Taylor, Commissioner for the Baltimore City Health Department, and ask Michelle Spencer to come back up, Deputy Director, of course, of the Bloomberg American Health Initiative, who will share more about how we are partnering to strengthen the health and well-being of our home city. Again, thank you all for being here today, and I hope you have a terrific, terrific summit.